Welcome back. It is 8:40. The World Health Organization has declared monkeypox a global emergency. Where are we with COVID in this country? And the biggest music event in our city arrives this weekend. How is COVID going to impact Lollapalooza? Joining us to discuss this and much more is Chicago Department of Public Health Commissioner Dr. Allison Arwady. Good morning. Great to see you again. So let's start right away with Lollapalooza. Hundreds of thousands of people expected to attend. Are there any restrictions this year, like proof of vaccines or proof of negative test?
There's no formal restrictions. If you look at where we were a year ago to where we are now, we've really made amazing progress in terms of having people be able to be protected. I do ask folks, if you're not feeling well, stay home, take a test if you're unsure. But really at this point, we know outdoor events are safer than indoor events. We know young people are less likely to get severely ill, but we ask folks, just make sure you are up to date on all of your vaccines and put a mask on if you're going indoors at any events, to and from the festival in particular.
So last year there were concerns it could be a super spreader event by others, not by the city, but it turned out that was not the case. Are you worried at all, given that Chicago is now seeing a high level of transmission, about an increase and a surge after?
Yeah, so last year, we really looked at all the data and we said, we're a little nervous about this, but based on what we know, outdoor events are much less risky. And this year too, I do think we're seeing a lot of COVID right now. And so there will be some people for sure who attend Lollapalooza who develop COVID, but we think it's unlikely that the event itself will drive any significant spread. It's more likely if folks are gathering, going to bars, going to parties. Again, put that mask on indoors and enjoy yourself while you're out of doors. Is a great way to lower the risk.
So will these COVID surges ever end? Summer was supposed to give us a break. That's really not been the case. What does this mean for the fall?
Yeah, so what I'll say is when we look at the numbers right now, we're seeing a lot of COVID cases, but not very many severe COVID cases in terms of people getting really sick, going to the hospital. We're at almost the lowest death rate we've seen throughout COVID. So it is a lot of disease right now, but really different than what we were seeing before vaccines. I think looking to the fall, we are going to see an updated vaccine, a vaccine that has had some changes in it to better be able to protect against Alpha and Delta and Omicron. The vaccine we've been using so far is specific to the original COVID variant. And so I'm hopeful that with that updated vaccine, we'll not only see continued protection against severe illness, but we'll see more protection against these breakthrough infections that we are seeing a lot of. Even if they're mild, they're not good because we can continue to see these surges like we're seeing.
Oh, interesting point that I had not thought about. Okay, finally, let's talk about this, because over the weekend, the World Health Organization declared monkeypox a global emergency. Chicago providing shots for those at high risk. But what do you want the general public to know about monkeypox? Are we all at risk?
So monkeypox is not like COVID. I want to be clear about that. You don't get monkeypox just passing somebody in the grocery store or through casual contact based on everything we know now. When people develop monkeypox, they get a viral flu-like illness and then these sores that can develop. And it's really skin to skin contact with these sores. And especially if you're having long or extended intimate contact, that's the highest risk. So the general public at this point remains at low risk, but most of the cases we've seen have been in men who have sex with men, just because that's the social network it's spreading in. And so we'd ask people to be especially careful. And again, if you're having any symptoms or rash, go see the doctor. They can take a swab, make sure it's not monkeypox. And we can get vaccine to anybody if they are exposed to someone with monkeypox. But getting tested is that first step, and any doctor can do that test.
And I know there were concerns too, because 2 young children came down with it. And you said it doesn't spread the same way, but how can something like that happen?
So it can spread through this close contact with sores. So if you, for example, have a household contact, we do worry about other people who live in the household of someone who would have monkeypox. Even if, for example, one of these sores, you were getting some of the fluid on towels or, other things that multiple family members could be sharing, it is possible to transmit it in that way. Again, general public at low risk, you have to have that close contact, but that is how we can see it. And most, but not all, of our cases in Chicago have been in men who have sex with men. We haven't seen any children diagnosed at this point, but in the US, there have been a few, and there will likely be a few now. We just want folks to be a little bit extra careful, especially as we're heading toward market days, et cetera. That's just where we're seeing most of the cases.
Okay, Dr. Arwady, I just got to give you a little bit of a hard time here now that we've gone through all the serious stuff. As we said, Lollapalooza is this weekend. And we got a little preview of your outfit, if I'm not mistaken. I want to show this video, you and the mayor getting ready for Lollapalooza. And look at you. Is that what we will be sporting this weekend?
Unlikely that I will be sporting that in public.
Oh, but we have it on video to save for the rest of your life. We always appreciate you coming on. Have a great day, and thanks for joining us again this morning. It's always a pleasure to see you.
Thank you so much.
Okay, you take care.